Thank you. As Laurie said, my name is Lauren McCallum. I am account executive for Cape Cod Municipal Health Group at Harvard Pilgrim. Julie Scansaroli is with me from Blue Cross. We're just going to go through a little bit about how the high deductible plan works. The plan works the same for Harvard Pilgrim and Blue Cross, so everything we say is really interchangeable and applicable to both plans. Please feel free along the way to stop and ask questions, or, if you have a question maybe you're not comfortable asking in front of everybody, feel free to pull one of us aside afterwards. We're really here to help you and to make sure that you understand this great offering that the town is putting forth for you. We do have some materials here if you didn't make it to the health fair yesterday. That you can take, on the high deductible plan, and if you need some help falling asleep tonight, you can take a read. So with that, so again, we're just going to kind of go over, these consumer-driven health plans, what it is, the HMO and PPO design features. We're then going to talk a little bit about the health savings account that is associated with this high deductible plan, and then, questions and answers. But again, please feel free if you have a question as we go through to let us know. So just a little bit on the basics. So as we talked about, the town offers an HMO and a PPO high deductible plan. So if you are on one of the Harvard Pilgrim or the Blue Cross plans today, the network is the same as what you're accustomed to. So the high deductible HMO network on Harvard Pilgrim is the same as the traditional HMO network on Harvard Pilgrim, and the same for Blue Cross. So your doctors aren't going to change. The function of the plan isn't going to change. What's covered, inpatient, physical therapy, office visits, things like that. That's not changing. What's changing is your cost sharing and how you now pay for these services. Just as a reminder, HMO plans, you need a primary care physician on file with both of us. You need referrals to see specialists, and you need to stay within our respective networks of doctors. So again, nothing different if you're on an HMO plan with one of us today. The PPO plan, if you're on the PPO plan, does not require a primary care physician on file with either one of us, and that's because referrals are not needed to see specialists. With the PPO plan, you get both in and out of network benefits. So in network, you're going to have a lower cost sharing when you see contracted providers, and out of network, you can see providers who aren't contracted with Harvard Pilgrim or Blue Cross, but it is going to come at a higher cost sharing for you. So any questions on that? Again, the network is exactly, the same, as you're used to today. So a little bit about the plan design. So again, I know I sound like a broken record, but everything is applicable to both Harvard Pilgrim and Blue Cross. So for the HMO plan, there is a $2,000 deductible if you are on an individual plan. If you are on a family plan, there is a $4,000 deductible. So if you're on an individual plan, $2,000, family, $4,000, and that $4,000 can be met by any combination of your family members. So that individual deductible level does not apply if you're on a family plan. You could go in on July 2nd and need knee surgery, and you're going to hit that $4,000 family deductible right away. Or you could have $1,000, your spouse could have $1,500. Where's my math? Kids can meet the rest. So it can really be broken up anyway. So if you're on a family plan, that individual deductible does not apply to you. The big thing to know on these high deductible plans, and I'll probably say it a few times, is all services are subject to the deductible. So when I say all services, I really mean all services, with the exception of a few preventative services. So things like your routine physical, that office visit itself, where you pay a $0 copayment today, you will not have a cost sharing for that office visit. What you have done in that visit could be something that is subject to your deductible. The Affordable Care Act has a list of select preventative tests, same as it does today, that are not subject to your deductible. So think routine blood, urine, cholesterol, mammograms, pap smears, things like that. But you may have something else in your physical that, is part of your preventative exam, but it's maybe more of a diagnostic service. We do have some examples coming down the road, and this is one I always use for myself because I'm on a high deductible plan. When I go for my physical, my doctor checks my thyroid. That is not a select preventative test. It's a diagnostic test. So that is subject to my deductible. So the office visit itself is no cost to me, but depending on what I have done in that physical, is subject to the deductible. The other thing, prescription drugs, they are also subject to your deductible. And then once you hit that deductible, you will have cost sharing, the applicable co-payments like you do today. On the plan itself for your medical services, once you hit that deductible, pretty much everything becomes covered at no charge for you. So once you hit that $4,000, things become covered at no charge. Again, with the exception of prescription drugs, there is a co-payment afterwards. Both plans do have what we call a preventative drug rider. So there are some preventative drugs that are covered with just a co-payment and are not subject to the deductible. So again, the way to look at this plan really is everything is subject to the deductible, with the exception of your routine physical, select preventative drugs, and then select preventative tests. Does that make sense?
In some scripts, but some may not.
Correct. So again, there's a list, and it's the same. I don't know if it's the same actually.
Our list?
The preventative drug list. They're very similar if they're not the same.
I'd be shocked if
The
there
preventative
wasn't. Yeah.
tests are the same because those are determined by the Affordable Care Act. But yes, really the way to look at this plan though is everything is subject to the deductible. So a little different than what you used to today, going in, paying maybe a $20 copayment, when you are sick with your primary care. Now you're going to be responsible for the cost of that visit.
This is pretty much what you were talking about.
Yes. So again, where am I? Sorry. So yes, this is just a little bit about how the plan works. So as you can see, your routine office visits for your physical, also not subject to the deductible, annual GYN exams, prenatal, postpartum care, immunizations, and then as we talked about, select screenings and tests. And then other services which are subject to the deductible, as we talked about, anything that's really going to be considered diagnostic. So non-preventative office visits, you think you're sick, maybe you think you have strep throat, going to go see the doctor. Now that office visit to your primary care is subject to your deductible, as well as that test for strep. Any imaging, non-preventative labs, emergency room, inpatient, day surgery, basically all of the above. So is there any real questions on what would be subject to your deductible, what wouldn't be? Well, every person is unique. What is subject to your deductible and what isn't is truly defined, and it's the same for every person. Mm-hmm. So, your history may be a little different than, if you had a spouse, what their history would be.
So between Lauren and I, when we go in for our routine physicals, every test that we're going to have is going to be the same unless Lauren might have some thyroid testing done. I don't get my thyroid tested. So that thyroid testing is individual to her. It's not routine. So that's going to be subject to the deductible. That makes sense? Yes. Great
So
question.
you're responsible for the cost of the visit until you hit that deductible, or the cost of the then things are either covered at no charge, or there is a co-payment for prescription drugs.
You still could end up with co-pays even after you get that.
Only on prescription
Only on
drugs.
prescriptions.
Once you've met that deductible, everything's covered in full for the rest of your plan year.
And one thing that's really important to note too is, you're going to pay what Harvard Pilgrim or Blue Cross would pay. So if you go in for that sick visit with your PCP and they're going to charge $350, but our contracted rate is $225. $225 is what's going to be subject to your deductible. And what's really important is, both Harvard Pilgrim and Blue Cross, once a provider submits a claim to us, We're going to adjudicate that claim. We're going to send sort of what we call an explanation of payment back to the doctor saying, okay, here's what you submitted the claim for, here's our contracted rate, and X amount is subject to Julie's deductible. We're going to send you that exact same thing, and you should be matching that up to what the provider's billing you. They should be billing you what we're telling them is subject to your deductible. They cannot ask for deductible expenses up front because they do not know where you stand.
That was gonna be my
Do you-
question. So when you
Yes.
go to the doctor, you don't know what it's
Yep.
going to be, so they bill you, and then you get.
Correct.
Yeah, so there's no
The-
more making that co-payment at the doctor's office. It's, they're submitting that claim so that it processes against your deductible.
And the only exception to that
Right.
is prescription drugs. Prescription drugs are a point of sale transaction, and they do know where you stand. The pharmacy knows where you
Yeah,
stand.
they real-time can run a claim, so.
So prescription drugs, you're going to be asked for that deductible expense up front. Any other provider, nope, they're going to bill you once they've heard from us how much is your responsibility. I cannot stress enough that you please make sure you match up what either one of us is telling you is your responsibility to what the doctor is billing. We've seen multiple times that, they may bill what their,
Yeah,
off the shelf rate
I
is.
just had an example of this the other day. My son's been pretty sick. I've been taking him into Children's Hospital, and I had just been in at Blue Cross. We have our My Blue portal. So you're able to log in, you can check all your benefits, you can see your claims, and I had been seeing that his claim was pending. Well, I got the bill from Children's, and I'm looking at it, and I go, all right, I know we were like $300 off from meeting our deductible already for the year because he's been that sick. This bill's too much. So I called into Blue Cross customer service and said, yep, I'm definitely getting the difference of a bill. They called over to Children's. Sure enough, Children's hadn't submitted an adjustment through their system, so they were billing me for more. So it's so important to make sure that they match.
And, like what Julie did, if you ever see a discrepancy between what you're being billed from the provider and what we're saying your responsibility is, call either one of our member services. That's what they're there for. They can contact the provider for you. We both have member portals. You can email member services if you don't have time during normal call hours. We don't want to see you overpaying because that money's just going to the doctor and you're already paying enough to begin with. So. Correct. It's $4,000 as a family unit, but one person could ideally, essentially meet that deductible for you. So both Harvard Pilgrim, both Harvard Pilgrim and Blue Cross, hopefully you all, whichever plan you're on, you have a username and password and you're part of, our member portals. We both have tools. Harvard Pilgrim's is called Estimate My Cost. Blue Cross is the cost estimator, we're very original. But you can go on and you can put in whatever type of service you're having. Say, like Brian said, an MRI, and it's going to be tailored to your plan, where you are in your deductible, and it's going to give you an estimate of what that service is going to cost. It's also going to give you, other options. So, an MRI at Shields is going to be cheaper than an MRI at, Mass General or Cape Cod Hospital. It's kind of a way for you to be a consumer, in your health plan. With that, to Brian's, what Brian said, the cost of an MRI is not the same, no matter where you go. Even our contracted rates aren't going to be the same. They're going to be around the same, but that's part of this transparency tool to be able to see that it's going to be cheaper to go here for this service than it is for there. So we both have tools where you can go on and you can look at, it can try and help you be a consumer in your healthcare.
The key to using those tools, though, is that you have to be registered for that portal.
Yes. You have to be logged into
Because
the
it's
portal.
gonna, registered, logged in, because it's going to be specific to your plan and your deductible.
And another way you can, if you want to take a look at your past utilization, so if you go on today and you look at your claims, from this past year, you're going to see what that cost, if you went in for a sick visit to your PCP, you're going to see what that cost would be. And so now okay, if I go in for that next time, this is what it's going to cost me. We both have tools, that can help reduce costs. You know, if you have sort of those like low acuity kind of urgent care needs, we at Harvard Pilgrim, we have doctor on demand. You know, you're going to pay a lower cost than probably if you go see your primary care. You know, you have a UTI, or you know, you need a Z-Pack. You know, there's many tools out there, urgent care, minute clinics. Some of those may be cheaper than going to your PCP, but you know, this tool really this plan really is to kind of get you to be a consumer driver in your health plan. One thing I didn't mention, I kind of skipped over quickly, and I apologize. So we talked about the HMO plan. So on the PPO plan, you know, it's exactly the same. It's $2,000 for an individual, $4,000 for a family. In-network benefits, you know, if you see a contracted provider, it's going to be subject to your deductible, then no charge. If you do go out of network, it would be subject to your deductible, then there is a co-insurance for there. But they work exactly the same. And again, back to the networks don't change. What's covered on the plans don't change. It's truly just your cost sharing is going to be a little bit different now than what you're used to. So, yeah.
Sorry, do you have a list of which drugs are not subject to the deductible and which ones are?
Yes, we can get those for you, definitely. So does anyone have any questions, I guess, on the network, how the plan works? Next, we were going to go into just like a couple examples, and then we'll get into the health savings account that is associated with this high deductible plan that can help you pay for these services. But were there any questions? Okay. So just quick example here, you know, you injure your knee, so you got to go see the doctor. So as we talked about, that visit to the doctor is going to be subject to your deductible. If you need an MRI, subject to the deductible. You need day surgery, I think you're seeing a pattern here, subject to the deductible. And then follow up for physical therapy, subject to the deductible. Let's be honest here, probably that MRI is going to wipe out some of that deductible, depending if you're 2,000, 4,000, definitely probably that day surgery. So if at any point, you know, during this example, you hit your deductible, the other services become covered at no charge for you.
So this may sound like a stupid question, but when you say subject to deductible,
Yeah.
does that mean it's definitely going towards your deductible?
Yep.
Okay.
Yeah.
Because I didn't know if it's like, okay.
Not like subjective.
Yeah.
Yeah.
All right, got it.
So, next. So I talked about this a little earlier, you know, you go for your routine physical. So that office visit itself is covered at no charge for you. So remember, the doctors are billing for their time as an office visit and then anything they do to you in that visit. So any sort of labs or services. So that visit itself is covered at no charge to you. Your routine blood work, maybe you get a flu shot, the urinalysis, those are all part of that select preventative care list from the Affordable Care Act. Those are covered at no charge to you as well. But maybe your doctor says, you know, you need an EKG, and like me, you got to get your thyroid checked. Those are diagnostic services, so those become subject to your deductible. And then your doctor sends you to a dermatologist because you got a couple moles. That visit to the dermatologist and then any probably poking and prodding and scraping that he or she's going to do, that's going to be subject to the deductible as well. And again, you know, they can't be asking for any of this money up front from you because they don't know where you stand in your deductible. So do those examples kind of make sense? I know I, again, sound like a broken record, but really, mostly everything is subject to your deductible. So with that, I think if there's no questions on the plan itself and how it works, we're going to talk a little bit about a health savings account. So this health savings account is an account that's associated with your high deductible plan. And both Harvard Pilgrim and Blue Cross, we partner with Health Equity, and Cape Cod Municipal Health Group and the town partner with Health Equity to provide this health savings account for you. They are a 24/7, 365 operation, so if you ever had questions on your account, you you can really contact them at any point. So, what is a health savings account? It is a tax advantage savings account that can be used to pay for medical, dental, vision, and really any other qualified expenses now, or what's great, later on in life. You don't have to use this money now. It's your account. So, the money that you put in, if you choose to put some pre-tax money in, that's your money. It's not use it or lose it like a flexible spending account. It's yours. It stays there. If you leave the town, it goes with you. The town also graciously is going to contribute half of your deductible to this health savings account for you. So if you're on an individual plan, the town's going to give you $1,000 in your health savings account. If you're on a family plan, the town's going to give you $2,000 in that health savings account. So essentially cutting your deductible in half, and you can now use that money towards your deductible expenses. You also don't have to. You can let it sit in there if you want. But again, it's even the town's money, it's your money. So it stays with you, you don't lose it, it rolls over year to year. And if you leave, if you leave the town, which why would you? Then it would go with you. You can carry the account with you. There is a nominal monthly fee from Health Equity, or maybe you go to a new job that has a health savings account, you can merge them. There's many things, but it's your money at the end of the day. Can you go back for a second?
Oh, sorry.
That's okay. So you can make, besides the money the town's putting in, you can put pre-tax money in, from payroll at any time throughout the year up to the IRS contribution limits, which we have a slide in a minute about that. Another thing is, you can use those, like we said, you can use this funds for expenses that happen today. You can use it for expenses that happen later on in life. And for your spouse or any tax dependents, you can use that money for as well.
So you can't use it like a CVS and stuff like that for your copay?
Yep, you can use it similar to like a flexible spending account. Yep, so if you go, to the pharmacy and you have a prescription that's subject to the deductible, you can throw that card. You'll see you're going to get a credit card. You can pull that credit card right out and use it right then and there. So the health savings account, they kind of call it the triple tax advantage. So tax-free, so again, you don't have to pay any federal income tax on money that you contribute to your HSA. You can grow your funds. So once you have $2,000 in your health savings account, you can invest that money in the stock market through Health Equity. You can kind of do it on your own. They have people that can guide you. Not something you have to do. It's just an option that's there for you. And you do not pay taxes on the earnings in that account. And then, withdrawing, so you don't ever pay taxes when you use your funds on qualified expenses. If you needed to take money out of that account for some reason that was not a qualified expense, you would be taxed on that. And if it is prior to 65, you would incur a penalty. But anything you're using that's a qualified, no tax there. So a little bit about the guidelines. So in order to contribute to your health savings account, you have to be enrolled, in a qualified high deductible plan. So the plan the town offers is one, so don't have to worry about that. But some things that are really important. So you can't have any other health coverage. So this includes Medicare, Medicaid, or TRICARE. So it's pretty important if anybody doesn't look like it, but if you are approaching 65 and you're still working, that you really defer Medicare A and B, because you cannot have that and contribute to the health savings account. You could be on a high deductible plan, but it's all about the account. So you can keep the account to use for qualified expenses, but you can no longer contribute. So we talked about contribution limits. So you besides the money that the town puts in, you can take, those pre-tax dollars, and you can put into your health savings account up to the amount determined by the IRS. So if you're on an individual plan for 2023, it's $3,850. So this includes the $1,000 from the town, so the maximum as an individual you could put into your health savings account would be $2,850. If you're on a family plan, the year, annual contribution amount for '23 is $7,750. And again, you'd have to factor in the $2,000 from the town, so the most you could put in would be $5,750. If you are 55 or older, you are eligible to put in an extra $1,000 as a catch-up, they call it. And then, so yes, employer-employee contributions, they all count towards the maximum. I feel like I had something else to say on that, but any questions on the limits? Oh, this is what I wanted to say. If you start out, with one contribution, you can change it throughout the year. So unlike a flexible spending account where you're kind of like locked in when you pick at the beginning of the year how much you want to put in, you can change throughout the year. You can start off strong and say, I'm going to do the full amount in there. I'm on a family plan, I'm going to put $5,750 in each week. And you realize this is kind of a little too much that's coming out of my check. You can contact, the HR office, I think, right? HR office, and they can adjust for you. Or vice versa, you are starting out a little and you realize, yeah, I can put a little bit more in. You can do that. One thing that's different from the flexible spending account, where if you are familiar with an FSA, when you decide what you're going to put in, that money's all available to you right away. With the health savings account, it's only available to you as you put it in. One thing that's great, and I think we talk about this down the line, if you need services, you need to pay for services right away, but you don't have the money in there, you can pay yourself back later. And then, can you go back, I think 1 or 2 slides, I forgot to mention what you can't be enrolled in here. So I don't know if I said this. If you are enrolled in an FSA, you cannot be enrolled in an FSA and a health savings account. So if you're enrolled in one today, you will have to discontinue that, or you can't have a balance either.
Yeah, so you'll have to spend that down before you can enroll into this plan.
So eligible expenses, so, as we talked about, co-payments, deductible, but there's a load of other things that, are available to you as well. Things like some dental, vision, as we talked about, prescription drugs, anything that's maybe not covered on your plan, but is a medical expense, you could use your HSA funds for that as well too. And with the CARES Act during COVID, they did have some over-the-counter. There are some now over-the-counter products and things that you can use your HSA on. Health Equity has a whole list of everything that is available to you. So spending your HSA. So as Julie mentioned, you will get a debit card. So you can use that debit card, if you're at the pharmacy for a point of sale, or if the provider is sending you a bill, you can send that, send that credit card number into them. Health Equity has a great portal that you could go online and you literally press a button, pay your provider. You can do what I do. You can pay yourself, with your credit card, because I like to get points so I can go on vacation, and pay yourself back. So there are multiple ways. It's really easy. Gone are the days of save all your receipts, fill out a paper form, mail it in, track it. There are multiple ways to make it easy for you to use the funds in your health savings account. And so this is sort of just a little, we talked about this earlier, but, how it would work. So you go to the doctor, you give them your Harvard Pilgrim or Blue Cross card. They'll send us that bill. We will, adjudicate the claim based on our contracted rates for the services they're billing us for. And then we send both you and your provider that claim summary saying, X amount is subject to your deductible. And then this is where you now decide how to pay your provider. Whether it's, we said with that debit card, use your own money and pay yourself back, or use your own money and save those funds in there. Knock on wood, I have been on a health savings and high deductible plan for probably about 15 years. I know how, I don't look that old, right? But I have been on one for about 15 years, and I'm a physical a year person, but that thyroid test is maybe like $40. I save my money and I'll pay on my own. for things that I'm able to. Anything that's small, I try and pay on my own to build my funds up. I have over $30,000 now in there, saving for the future. So, it's your account. You can decide what works for you and how it best will suit you and your family's needs. So whether that's saving for the future through this triple tax advantage or, using these funds. Again, it's your money, so you can decide how you want to pay for your services. You can use the funds to help pay for Medicare premiums, any of those eligible expenses. Prescription drugs, we talked about this as well too. You have that debit card, so you go to the pharmacy, show them your ID, they'll apply the discount, and then you can pay right there with your HSA card, or, again, choose to pay on your own, maybe pay yourself back, or maybe it's a small enough copay amount that you can just let your funds sit there. But there are just so many multiple options and ways for you to use your funds, pay your provider, pay for your prescriptions. They really do. Health Equity makes it pretty easy and seamless. So yeah, as we talked about, their portal is very user-friendly. You can see your balance, again, review claims, transactions, submit those. You can submit claims if they're not there. We both have feeds that go directly to Health Equity, so any claim that we're getting, we're sending over to Health Equity, so it'll be in your portal the second it's in your member portal with us as well. And as we talked about, pay your providers, reimburse yourself. You'll get tax documents every year because this is, a tax account, savings account. And then, there is the mobile app as well. And if you're, one thing, I suggest the first time I moved to the high deductible plan, if you're maybe unsure about contributing to the HSA account, like you're not like, oh, I don't know if I can maybe afford to, but you want to move to the plan, take the difference that you're going to see in your premium, your weekly or biweekly premium, and put that, at least that, into your health savings account, because this way you're not going to see a difference in your check. It's a change from what you're doing today of going in and paying a copayment. It's different. So, and I will stress this part again, always make sure that you are, there's a little bit of, paying attention involved. So always make sure that what you're getting billed is what either Blue Cross or Harvard Pilgrim is saying is your responsibility. But that savings out of your paycheck every week or every 2 weeks is really going to offset that deductible, given that the town is contributing half of the deductible for you. Thanks for coming.